Hello, this is Dinanath Kholkar, and we have with us Kurush Irani from Bajaj Finserv. He heads the CSR initiatives. And thank you, Kurush, first of all, for agreeing to do this session for us. Always good to connect with you again. Would like to hear from you about the CSR initiatives and the focus areas at Bajaj Finserv.
Definitely. Dina, thank you for this opportunity. We have worked together in different capacities, but I'm most excited about this opportunity that we both have and the impact we can create through the network that you are building. To the specific question you asked on Bajaj Finserv, CSR and our priorities, I'll just take a step back. The CSR laws have come into place 10 years back. The Bajaj group per se has been associated with social work, with the freedom struggle, in fact, all the way back for many, many decades now. So the social aspect, along with the work aspect, is not something which is new for the group. The laws which came in 10 years back have just brought in more structure, specific requirements from compliance, from regulatory aspect, and it brings a much larger ambit of organization into space, which is helping out. So I think it's been a very great move. Talking about our focus areas, specifically for Bajaj Finserv, our segment that we have defined. So we are focused on who's a beneficiary. The beneficiary that we are looking at is the youth. So that's our focus area. And we are calling out youth of today and youth of tomorrow. So we have broken it in that segment. Youth of today is where we're saying that this is somebody who is now, given India's economic growth, what we want India to be, is looking to get employed. At the same time, we are hearing from the industry that we are struggling to get skilled manpower who will take the journey forward. So in the youth of today, our main focus area is skilling. How do we enable the youth to become employable? So that's our key focus area from a youth perspective. Towards this, we have a couple of areas that we work on. One, given our own domain in financial services, we have built an in-house program called Certificate Program in Banking, Finance and Insurance. This is a 100-hour training module where the content has been created. We have partners who then deliver this in colleges. Typically, we target the final year students, mostly in a BCom or a BBA college, so that they get real life experience on what does it actually take to work in these areas. So the program has been built from that perspective. It also includes modules on communication, on self-worth, on attitude, and this enables them to get a better opportunity to join the financial services space. Through this program, CPBFI, I think we are present in over 100 districts and 300 plus colleges. This year, 20,000 students would have gone through this program. So it's completely funded, both in terms of program creation, delivery, taking it to the colleges from our end. So this is creating a pool which becomes a target base for the financial services organizations to hire from.
It is very interesting that you mention about the youth, because one of the patterns that we are seeing is a great amount of people wanting to become entrepreneurs, first-time entrepreneurs. And our education system doesn't necessarily teach you how to do business and just basic financial literacy which is required. So in a way, the work that you guys are doing is very, very fundamental, and it is very important for the economic development of the state and the region that we are in. So absolutely commendable work that is being done. But how do you see the steps? How does it percolate down? This is at a youth level. Do you also focus on creating some basic literacy in households or with young students?
So let me come to that second. So as I said, it's youth of today and youth of tomorrow. So for youth of today, it is skilling. This was one of the programs, and then we work with our partner ecosystem, which are typically our implementing partners, NGOs, who are doing bunch of trainings pan India. That's on the skilling, on the youth side. The youth of tomorrow are today's child. Within that, and specifically in Pune, Dina, that's where we are focused on. We're looking at 4 segments: education, health, protection, and inclusion. Inclusion being people with disabilities. So these are the 4 segments we look at. We're not necessarily only focusing on financial literacy. So when you look at, if I take child education as an example, today in PMC of the 280 odd schools that they have, we have some other intervention in nearly 110 of these schools. And it varies. So right from FLN, the Foundation Literacy and Numeracy, helping implement NEP which is put into place. We believe that vocational training can be a big differentiator. Today, most of our education is very straitjacketed. If you look at a lot of other countries, vocational training becomes a big part of an opportunity which the child can take on. So again, working with a partner ecosystem of how do we bring in vocational education early on, supporting that is an example of what we're doing, say, in the education space. Similarly, there are examples on health, on protection, and on inclusion that we work on. So lot of activities from a child perspective, but with the ecosystem of the partners that we have.
Interesting. And given that the Pune metropolitan region itself is expanding so fast, and a very diverse set of people which we need to target for, absolutely critical. Tell me more about how do you encourage innovation in your partners, and how do you look at evaluating them when they bring in proposals to your activities? Because obviously, as the scale is growing, as the impact needs to be more profound, you would look at innovative ways of delivering the same type of services. So if you can just give a perspective, it would help our social innovators understand how a corporate evaluates their proposals.
Sure. This is a tough one. So let me attempt with some examples. Now, innovation can be of different types. Innovation can be on product, can be on process, can be on how you view the project or the program. If I take product as an example, and if I look at people with disabilities, there's so much work happening on assistive technology, on what are the products that can help out. One of the partners we worked in was NeoMotion. So they came through the incubation process with ATF. They have created the specialized wheelchairs for people with spinal injuries, and it's customized for them, enables them to not just move but also look at employment in terms of how it happens. So there, Dina, it's more about, as we find these partners, some of these are so new that they need to create more of the proof points. So how can we enable that from a simple product perspective? But it's very critical from that sense. We're focusing a lot on the program structure. So innovation more in terms of how can we collaborate and bring in a program structure view. Let me give you an example of the work we're doing on cleft. So cleft and palate is something that a child is born with. It has no bearing on your social status, etc., from where it emanates. But if you think about it from a child's perspective, it can impact your height, weight gain, etc., from a health perspective, because your feeding is impaired. As you get into education, most of these children also suffer from some of the other social element because of the way they talk and how the other children and the community behaves around them. And unless it's taken care of, this continues, and they sort of live with this social stigma as well as from a health perspective. So we've been supporting organizations, say like a Smile Train. We've done over 8,000 surgeries over the last many years to help children take care of their cleft and palate. One of the discussions we had with them, and this is what I mean by the process or structure innovations, is this is a approach from a surgery perspective. But if you have to actually think of the problem, what else can we think of? So what are the other variables that are coming into play? As we discussed with them, 2 or 3 new variables came out. So one is, even if you're doing surgery, there's a timing of surgery. When do you do it? There's a certain right time to do the surgery, and oftentimes the parents or even the doctors, as you go deeper, are not aware about it. So they may either not end up doing it on the right time, delaying it, not doing it, oftentimes even doing it early on. So there's an element, one variable I would put would be, 1X is timely intervention. Second is complete intervention, because typically in cleft, you don't get it resolved by one surgery. So you need, say, 2.3 surgeries on an average over the next 10-12 years to take care of it. So we said, if these are the problem statements, how do we now flip the project to look at it differently? So we have taken Maharashtra as a unit. Over the next 3 years, we have taken a program called Maha Smiles, cleft care for every child. There's no database which tells us who has cleft and all that. So there's a missing database from a numbers perspective. But we know certain assumptions in terms of what type of percentages of people are born with cleft. We know the birth data. So we have done some mapping at a district level. So know in each district, what is the prevalence of it. First level is how do we build awareness, because awareness is not there.
Sure.
So they are again using ASHA workers, using organizations like Foxy. We are creating awareness of what is cleft, how does it occur, when it occurs, what is the right time, so that awareness gets built up. We are going to start running campaigns through media so that people at large get aware of it. So that awareness will help solve for the timeliness of it. Second is, even if that's in place, do we have the capacity to treat it? So again, in the respective districts, basis the data we have seen, with our partner, we are creating capacity of doctors and hospitals who will do the treatment. And the next is the follow through. How do we make sure we don't end at it? So to me, Dina, that's also innovation, because the problem is being turned around on its head and being looked at in terms of how do we solve for it. And many more such examples where we're taking a structural approach.
One was very insightful for me, because when I was going through your annual report and I saw that as a clear highlight, and I said, hey, look, there is something very interesting, which is very unique, that an organization like yours has picked it up, and the numbers were quite impressive. The number of surgeries that you have done over the years and things like that is quite interesting. But it would be also useful for us to understand, how did you go about identifying such a niche area? Did it come across because of certain data points that you got as part of your business, or did somebody bring in you a proposal, somebody was passionate about that area? So, a little bit more background around this particular topic would be very interesting.
Our themes at aggregate level come from data. So why we are focusing on skilling or education, those are data driven. Within that, the specific intervention is not always data driven. It's just about getting exposed to that area, getting to know about it, and then building the belief system on the need, the criticality, and the absence of support, which helps carry it forward. And sometimes you have a champion in the organization. The champion in the organization could be passionate about it, or could have a personal connect with that, which also helps give it more wings to fly faster. So Cleft did not start as a top-down, data-driven approach, but as we engaged with the organization and as we got to know of it, the statistics they shared, the approach with which they are working on it, the impact it is making. It's not just the surgery, it's the whole social as well as health impact. Those are the things that clicked. And then typically we don't start large with any project. We start small. And depending on how the relationship builds up in terms of the quality of work, the impact to the beneficiaries, how it's being measured and tracked, that's when we start scaling it up. So what you see as a big program today has been over many years, because that trust and the confidence and the impact has been seen over the last few years.
So one interesting thing which I wanted to share with you, Pune International Center has a very strong partnership with Gokhale Institute. And Gokhale Institute is actually scaling up the type of courses that they're offering. And one of the key things that they're doing is on providing a bachelor degree in economics. And they need to collect a whole lot of data points for certain interventions that the economic development requires. So when you looked at something starting off small and you wanting to scale up, we potentially see the help of such researchers or teams which can collect data, because you definitely need data points to be able to scale it up. So I definitely see that as an opportunity when we look at organizations like yours, starting off, making a proof point, getting that confidence on some activity and then scaling up. Moving on
this,
to,
in fact, then I'll add on to it, and 100% in sync with you. Specifically, if I give a couple of thoughts and examples on this. So again, in child health, we work on juvenile diabetes.
I see.
On type 1 diabetes, we work with the Jangir Research Center. Not only are they doing the treatment and helping the economically poor section with the treatment, with the diagnosis, with actually going to communities and tracking and helping out, but they're doing specific research. So they are creating their own curves, which are India specific. They are doing research on it, and that research is influencing some of the work being done from a overall type 1 diabetes perspective. We're doing a lot of work with people with disabilities. And it's interesting you mentioned Gokhale Institute, because we are going to leverage them and their network, that there are so many initiatives that the government has to support it. As we work with some of the partners, we oftentimes find a gap, that there is something which has been created from a policy and from a program perspective, but it's not being leveraged, either because of lack of awareness or the process or the documentation, etc. Given the work we're doing in this space, we're trying to bring a consortium of some of our partners together and create some sort of a research and a handy book which says what do you need to do in what situation, so that we can leverage the larger might and the benefit that the policies and the government programs are offering from that.
No, absolutely. And we were just discussing before we started this interview was about how do we collaborate. Your organization doing some phenomenal work. There are other organizations which are in a similar space. There is data which they are collecting. So just wanted your thoughts, since we have started this initiative at the Social Innovation Lab on creating these roundtables where we'll have people with interest in specific themes. Your views about how do you see the value of that collaboration with others in the Pune ecosystem?
It can be very powerful. Operative word is can. To translate it from a can to it will be powerful, right? So I think at the very basic level, we have those 4 or 5 areas defined where we found commonality of interest. As we get these partners together and both sides, the donor organizations, to be as one vector to talk about their programs, what is working, where can we collaborate in terms of learnings, and then the partner ecosystem. And oftentimes the partner ecosystem need not be from the same field. You will find cross leverage, right? You'll find a lot of cross leverage, and that to me is also a bit, and you quoted some examples in our earlier discussion. We have seen a lot of examples. Sometimes we take a very linear view, whereas the benefit may come from a completely different area. What I would really like this roundtables to culminate or take things forward is how do we convert that discussions into some actionable projects that we take on. And I know it's a journey, but at least I'll push myself, and then I'll take your help also, that we start pinpointing few areas. And on those few areas, how do we convert it to actionable? Because there are enough forums available at different levels. Meeting and sharing is one, but how do we now enable it to translate into few actionables, few projects, and create that to build the...
No, absolutely. Our objective is obviously we want to ensure that people are aware of it. 1 or 2 action items from each of those roundtables, which will go into helping that set of organizations itself in maturing their processes. Also, it becomes an action item and ability for us to invest into certain things. Okay, so just to give you an example, the Social Innovation Lab provides shared service for many of the social enterprises which are there. And why was it provided? Because through the interactions we realized that everybody was trying to do the same things, and creating a shared service which could provide technology support became an easier thing. We were just discussing about areas of focus. We feel that organizations can potentially have shared services in form of doing basic research on which organizations, what are their priorities, and also help them with collaborative opportunities, saying that, hey, look, the target segment that you are having is this. There are these other organizations which are also targeting the same people, maybe in other domains, but they may have data which you can potentially use. So definitely a great opportunity.
And building upon that, similar to the shared service thought which BIC is doing, is the capability transfusion. So there are some partners who do fantastic work. And then in that same space, there is so much other work happening. How can we help take some of these capabilities from partner A to others who would directly benefit from that? So some of it are being done structurally as programs, but how can we enable that as part of this ecosystem and roundtable? I think will be very powerful, Dina.
Sure. A few other things which are more operational. There are many of these social enterprises. They have not necessarily got the hang of how a large corporate operates from a process point of view. And the simplest of thing is your annual action plan which you put together, the timing of it, how do you actually do the reporting of it, and things like that. So if you can just throw a little bit of light around a typical planning cycle and also the reporting cycle, because that sort of is a continuum, because you get measured on how much impact you are delivered. But you need to also plan, and you need to plan based on certain guidelines on the amounts which are there and stuff like that.
That's right.
So that would definitely help.
That's right. So the good news is, because of the CSR laws now, there is ample transparency and availability of all this information. So if for any of the existing or potential partners, one thing I would encourage them to do is use the websites of these companies. Most of them would have a CSR section. In the CSR section, you will find lots of information available, like in the annual reports as well as on those sections. Right? So I would definitely say focus on that.
And your CSR policy itself has a lot
the
of
details,
very
right?
interesting details.
So I think what you'll find is most companies would define to begin with, to Dina's point, the CSR policy. That itself gives a view on what is the approach, what is the focus area, what is the broad contours and the process. Most companies, depending on the size and scale, would have a CSR committee, would have a CSR committee, etc. So again, that gives you a sense of who are the people involved and what sort of scale you are working at. The value in terms of how much money is available is in black and white terms available. So again, you get to know what is the type of budget each of these companies are working on. Beyond that, I would say that, again, I'm still on that part, the annual action plan is put up on it. Since last year, now it's a mandate that all projects exceeding a certain value, you have to do a third-party impact assessment after the project is completed and it's been a year. Those impact assessments have to be made available on the websites. So again, that gives you a direct view into the specific project and the area. So if you start putting all this together, you can get a nice holistic view of what their organization is into. This is all through secondary research. What, along with that, Dina, I think from a process and flow perspective, what I have seen in my brief time here is, this is not a switch which just goes on and off, right? It takes time. So as you start engaging with that organization, you will start building some sort of understanding of their priorities. So of course, so as I called out, I have certain focus areas. I'm not saying the others are not critical, but we have decided to focus on these. So if it's something outside of that, either in terms of priorities or geography, we straight away say no out there, and we don't really go deeper into it because it is not in sync with our focus areas. But within that, it's very rare that a project gets approved immediately. There will be engagement, there will be field visits. You will want to understand, you will want to talk to some of the other donors, you will want to talk to the beneficiaries. You will want, at least this is our approach, you will want to start small, see how it's going, and then you take it forward. Behind that, there are certain basic paperwork which we take for granted, right? So as per the CSR laws, whether it's your company details, your the CSR certification, your eligibility, all of that is a given, and those are black and white. There is no leeway from that perspective. A few other things we look at is how significant will we be for that partner? For two reasons, right? We don't want to become so dominant that there is very high dependency that tomorrow if there is any change in direction, the partner is impacted adversely. Right? And vice versa also. If you're really small, then are we having the ability to influence and co-create programs? So there is that dimension. There is alignment with your priorities. There is basic paperwork. There's no timing view, Dina, because it's not as if that if somebody approaches us in August versus January, the results will be any different. We take a continuous view, and a continuous view is one that typically a new partner understand, start small, look for the next 1 year before we scale it up. And through the year, most of our programs are ongoing programs. So very few are like 1 year programs. And that's why even sitting here today, half my budget for next year is already consumed. But when we talk to the partner, we're not looking for a short-term relationship. So from that perspective, through the year also works. It is not time-bound in that way.
How is the involvement of your leadership team, or not necessarily only leadership, but across the organization, the participation of your employees into some of these initiatives, and how much that drives a decision? Because somebody could be very passionate about a cause and then bring it to at a corporate level. So just give a feel of that as well.
It is quite distinct. So we have kept the two quite distinct. We have tried not to, the two are not intermingled deeply. Even if somebody is very passionate about the cause, if it is not aligned with our priorities, it doesn't move. And we keep getting many such requests, but unless it is aligned with our priorities, which have been defined independent of the business, it doesn't move forward. If it's aligned with our priorities and the focus areas, even then it goes through the same evaluation process. There are no benefits or shortcuts or positives from that perspective. So that process continues to work well. From a broader employee-based perspective, Dina, I think we have more work to do. So while our HR teams parallelly do a lot of work with their employees, both in their individual and group capacity on the social side, it is not very deeply interlinked with the CSR work that we do. So the two sort of are working parallelly. We are making some attempts, and the attempts are more in terms of capability. So when we talk to our partners, a lot of our partners, we have realized, and the partners that told us that they don't need size in terms of 100, 200, 500 people. They need help on capabilities. So when you talk to them, what we typically hear from them is IT may help you. How we structure our web, how do we reach out, how do we create awareness, how do we think about our data, as an example. HR may help you. How should we think about our HR processes and all. Data may, what more can we do, and so on, right? So the people, when we're talking to them, we're finding that they're looking for that specific need which will help them scale up and run it. So that's something we're doing. So we reached out to our specific areas, and there it's more about co-creating and solving. So it requires certain element of domain. So that's the attempt we're doing with our IT teams, with our HR teams, with our marketing and data teams, that how do we align a mid to senior level resource with these partners who will give them time, as well as work with them to understand the problem and take it forward. So that's the approach we're taking.
That's a typical thing. Whenever you go to meet any of these founders who are running social enterprises, one of the things, they have a plethora of things, and they just don't have the bandwidth to do any of that, neither the expertise nor the bandwidth. And they typically look at one dimension of involving people in form of their volunteering efforts. But if they actually tune it down to very specifics around capability and skills, can make a lot of difference. My own experience in managing very large teams, one of the best use of these initiatives I found was to get the hierarchy barriers broken down, because you would have very young folks leading CSR initiatives, and you would have some of the unit heads joining as a team member. And it became very good as a means to actually get people to know a much broader set of people without having to go through a formal channel and things. Otherwise, you will have to do office events and stuff like that. So I could actually get people from different business units to know people in the organization through, and these would be like once in a month or once in a quarter type of event, but they would get to know people very easily. So it served as a very good purpose to break down the barriers and interact with people. So as a roadmap towards that, so one of the action items we took from your last roundtable was that we will create these sectoral roundtables, and we've identified education, skilling, healthcare, environment, women empowerment. So about 5 or 6 areas, so that we have one continuity in the roundtable that we do during the social innovation conference, and then we have engagement with CSR heads and others in this area. So we look forward to participation from you and your team.
As you shared, 3 of the 5 resonate straight away with the focus areas I've called out. We are committed to it, so we want to be part of this. We want to make it successful. It's aligned both from a focus and from a geography perspective. And having you play this lead role full time gives me that much more confidence on it taking off.
Thank you, Kurush. It has been wonderful talking to you, and I'm sure we will have many interactions going forward as well.
I look forward to that, Dina. Thank you.